Hello, my name is Angel Cisco, and today I'm going to be talking about 3 ways tested measurements could be used in the field of psychology, or more specifically in clinical psychology. And although tested measurements are an important subject that can be found in almost any subject, today I'm going to be specifically focusing on clinical psychology. And those 3 reasons are that tested measurements can be helped in psychological assessments, that it can catch covert behavior, and that it can measure something specific. Okay, so to begin, tested measurements can be used in clinical psychology for psychological assessment. And what psychological assessment is, it is a tool or it's a measurement device that can be used to quantify or classify a variable to specific behavior. For example, if a patient is having trouble sleeping and is having episodes of extreme sadness, we could use a psychological assessment to categorize or to identify the underlying issue, whether it be depression, anxiety, and so forth and so forth. So it is important. This psychological assessment is important because it helps the patient receive treatment, so that in the future we can bring the issue to a halt. So that's one reason why tested measurements could be helped or can be used in the field of clinical psychology. The second reason that test measurements can be used in clinical psychology is to catch covert behavior. And what covert behavior is, it is a behavior that is not so easily observable or detected. It could be used in clinical psychology to detect patients' underlying concerns. Say, for example, a mother brings in her kid who oftentimes she sees is super hyperactive, super sociable, but doesn't know what's going on. And so that's why tested measurements could be helped in the clinical psychology to detect those underlying concerns that aren't so easily detected. I know our professor did mention that there are some celebrities out there who go their entire career without even demonstrating their forms of depression. And so that's why we are so surprised when we hear in the news that they've committed suicide or they had suicidal thoughts. And that's why tested measurements are important in clinical psychology, so that we can detect those underlying issues that aren't so detectable to the eye. Yes. Okay. And my final reason why clinical psychology, or I'm sorry, my final reason why tested measurements is important to clinical psychology is because it could be used to measure something very specific. And what I mean by that is that in the real world, there exist multiple and there's a plethora of psychological disorders. And so by having tested measurements in clinical psychology or having a specificity, the client need not have to worry about their needs not being met. And what I mean by that is that if it is measured, it can be used by clinical psychologists for the future reference. So future psychologists can add on to the current disease, whether it be specific or not. Okay, and so to conclude, in clinical psychology, tested measurements can be used in multiple ways, but specifically what I mentioned here is that it could be found within the use of psychological assessment, and it could also catch covert behavior, and that it can measure like specific behaviors that aren't so usually recorded.